Bismillahirrahmanirrahim. Starting with the name of Allah Almighty, who is most merciful and gracious. Hope you all will be fine. In this video, we discuss thoracic cage, known as rib cage. Rib cage consists three parts: sternum, ribs, anatomical term of ribs, costae, and thoracic vertebra. Sternum. Sternum consists three parts. First part is manubrium, prosternum, second body or known as shaft, mesosternum, third xiphoid process metasternum. Sternum consists three parts: manubrium, prosternum, second body shaft, mesosternum, third xiphoid process metasternum. This part of sternum is scale shape, and this known as sternal notch, or also called jugular notch, and this known as clavicle notch. Angle of lowest between sternum 163 and this ridges part known as transversus ridges, and it also tongue shaped. Sternum is a flat bone midline of thoracic wall. Sternum is a flat bone midline of thoracic wall. Manubrium, superior portion of the sternum, broad and triangular shape, articulate with the clavicle and also articulate with cartilages of first rib pairs, has a jugular notch, a shallow indentation between the clavicular articulation, sternal costal joint attached with them, manubrium sternum joint attached with sternum and also with body. Junction with manubrium and body is called sternal angle. Sternal angle is 163 and further consists two bones and two beginning and two termination and two bifraction. Costal cartilage connect ribs to sternum. Costal cartilage connect ribs to sternum. Manubrium, superior portion of the sternum, broad triangular shape, articulate with clavicle and also articulation with the cartilage of first rib pairs, has a jugular notch, a shallow indentation between the clavicle articulation, sternal costal joint, manubrium, sternal joint attached sternum with the body. Junction between the manubrium and the body is called sternal angle. Sternal angle consists two bones, two beginning and two termination and also two bifractions. Costal cartilage connect ribs to sternum. Sternum body tongue shaped, attached to manubrium, attached to costal cartilage of two seven ribs. Sternum body tongue shaped, attached to manubrium, attached to costal cartilage of two seven ribs. Third part of sternum, xiphoid process, smallest part of the sternum, attached to the sternal body, attached to diaphragm and rectus abdominis muscle, smallest part of the sternum, attached to the sternal body and also attached to the diaphragm and rectus abdominis muscles. Ribs, 24 ribs in a human body, 12 pair. Shape of ribs curved, flat bones, long ribs cavity inside the rib cage. Interiorly front side attached with sternum, but back side attached with vertebra. Interiorly front side attached with sternum, but back side attached with vertebra. First cage has four borders or valves. First cage has four valves or borders. Interior made up by the sternum, posterior made up by the thoracic vertebra, and lateral made up by the ribs. And lateral made by the ribs. Interior made by the sternum, posterior made up by thoracic vertebra, and laterally part made by the ribs. Thoracic cage lies between the cervical and lumbar vertebra. Thoracic cage lies between the cervical and lumbar vertebra. Thin membrane covered lungs called pleural membrane. Thin membrane covered lungs called pleural membrane. Further divided pleural membrane in two parts. First part is visceral, a vesical membrane, pleural covered lungs, and second part is parietal pleura, protect thoracic cage. Thoracic cage, also known as bony thoracic, 11 intercostal spaces filled with nerves, lymph nodes, arteries, and muscle. 11 intercostal spaces filled with nerves, lymph nodes, and arteries and muscle. Intercostal muscle, three type of intercostal muscle. First type is external intercostal muscle, help in inhalation process. Second type is internal intercostal muscle, help in exhalation. And the third type is intercostal muscle, innermost intercostal muscle. Apical plus present between mid clavicular lines of fifth intercostal muscle. Apical pulse lies between mid clavicular lines of fifth intercostal muscle. Function of thoracic cage: production parietal organs, lungs, kidney, hearts, esophagus, stomach, etc. Provide attachment to muscle during respiration. Provide attachment to muscles during respiration. Helps in process expiration and inspiration. Two ribs, first to seven ribs, known as two ribs. Two ribs, also known as vertebro-sternal ribs. Two ribs called first seven ribs called two ribs because directly attached with sternum. False ribs, 8, 9, 10 pairs, known as false ribs, also called vertebral chondral ribs, indirectly attached with sternum. False ribs indirectly attached with sternum. Floating ribs, 11th pair of ribs, known as floating ribs, also called vertebral ribs, because they are freely interiorly in the body. Classification of ribs on the basis of structure: typical, first type is typical and second type is atypical. Typical consists 3rd, 9, 5th, 6th, 7 and 4. 3, 9, 5, 6, 7, 4 ribs are called typical ribs. Atypical ribs consist 1 to 12, 11 and 12 pairs or 12 ribs, known as atypical ribs. Atypical ribs have only head present. Typical ribs, which have neck, head, tubercles, internal surface, external surface, subcostal groove, angle, and articular facet present. Typical ribs, which have neck, head, tubercles, internal surface, external surface, subcostal groove, angle, articular facet are present. जबकि atypical ribs consist have only head present. Superior notch consist manubrium and vertebral, and inferior notch consist xiphoid. Superior notch consist manubrium, vertebra, and inferior notch consist xiphoid 11th and 12th ribs. First ribs, not upper trunk of the brachial plexus. First ribs have no upper trunk of the brachial plexus but have sympathetic chain, ventral ramus of thoracic 1 and subclavian artery are present. First ribs have not upper trunk of the brachial plexus but have sympathetic chain, ventral ramus of T1 and subclavian arteries are present. Second ribs have medium in size, has no angle, has two surface. First surface outer and second is inner surface. Inner surface downward and inward, outer surface rough impression just behind its middle, which give origin first and second digitationis of the serratus interior muscle. Serratus interior muscle also known as boxer muscle. Serratus interior muscle also known as boxer muscle. Second ribs medium in size, has no angle, has two surface, outer and inner surface. Inner surface downward and inward, outer surface rough impression joint behind its middle, which give origin first and second digitations of serratus interior muscle. Serratus interior muscle also known as boxer muscle. Eighth costal cartilage does not articulate. Eighth costal cartilages does not articulate directly with sternum. Tubercle of seventh ribs articulate with transverse process of vertebra T7. Tubercle of T7 articulate with transverse process of vertebra T7. Subpleural membrane is attached to its inner border. Tenth rib has single articular facet on the head, and it's the only characteristic of tenth rib. Tenth rib has single articular facet on the head. 11th rib single articular facet on head, no tubercle present. 12th rib single articular facet on the head and also no tubercle, no neck, costal groove, large head, tapering articular and present. No tubercle, no neck, and also no costal groove, large head, tapering interior and present. 11th and 12th pair of ribs are lumbar-like, body is large and contain single complete facet. Transverse process is large and contain not facet. Transverse process is large and contain not facet. Spine is short and quadrilateral. Transverse process is large, contain not facet. Spine is short and quadrilateral process. The vertebral foramen formed between the body and neural arch. Vertebral foramen formed between body and neural arch. Vertebral canal between the collection of all vertebrae. Foramen also contains spinal cord. Vertebral canal also contain spinal cord. Thank you for watching this video.